Hypoglycemia or low blood sugar causes and symptoms. Hypoglycemia refers to low levels of sugar or glucose in the blood. Hypoglycemia is not a disease, but it can indicate a health problem. All cells within the body, including in the brain, need energy to function. Glucose supplies energy, and the hormone insulin enables the cells to absorb and use it. In severe cases, low blood sugar or glucose may lead to coma and death. Hypoglycemia can occur with several conditions, but it most commonly happens as a reaction to diabetes medications such as insulin. People with diabetes use insulin to treat high blood sugar. This video explains hypoglycemia, including its causes, symptoms, and treatment options. What is hypoglycemia? Hypoglycemia happens when there is not enough glucose or sugar in the blood. The National Institutes of Diabetes and Digestive and Kidney Diseases notes that symptoms usually appear when blood sugar levels are below 70 milligrams per deciliter. However, this number can vary between individuals. People can check with their doctor to find out their personal level of low blood sugar. People with low blood sugar may want to use a blood glucose meter, a small portable machine that monitors blood sugar levels. Some monitors sound an alarm if levels drop below a certain level. People can purchase blood glucose monitors online or discuss with their healthcare team. Symptoms. People with mild hypoglycemia may experience the following common symptoms: hunger, tiredness, tremor or shaking, sweating, shaking, heart palpitations, rapid or irregular heart rate, dizziness and weakness, nausea. Severe hypoglycemia may involve confusion, seizures, nightmares, fainting, coma. Complications. If a person does not take action, they may have difficulty eating or drinking, seizures, a loss of consciousness, coma. Severe hypoglycemia can be life-threatening and in rare cases may lead to death without treatment. Someone who regularly experiences hypoglycemia may be unaware that it is happening or getting worse. They may not notice the warning signs, which may lead to severe and possibly fatal complications. Causes. People may experience hypoglycemia for reasons including not eating enough. Fasting or missing a meal may lead to low blood sugar levels. Not eating enough carbohydrates can also cause blood sugar levels to fall. Increased activity. Increasing physical activity levels can lower blood sugar levels for some time, especially in those with type 1 diabetes. Alcohol consumption. Drinking large amounts of alcohol can cause the liver to stop releasing stored glucose into the bloodstream. Some liver diseases, drug-induced hepatitis, can lead to hypoglycemia because it affects the liver. Kidney disorders. People with a kidney disorder may have problems excreting medications. This can result in low blood sugar levels. Insulinoma. A tumor in the pancreas can cause the pancreas to produce too much insulin. Endocrine problems. Some adrenal and pituitary gland disorders can lead to hypoglycemia. This is more common in children than adults. Reactive or postprandial hypoglycemia. The pancreas produces too much insulin after a meal. Tumors. Rarely, a tumor in a part of the body other than the pancreas can cause hypoglycemia. Severe illness. Some diseases such as cancer can affect many organs, including the pancreas. This can lead to hypoglycemia. Some medications can trigger hypoglycemia. They also cause blood sugar levels to drop. It can also happen when a person takes diabetes medication without having diabetes. Treatment. A person who notices the signs of hypoglycemia should consume 15 to 20 grams of carbohydrates or glucose, such as a glucose tablet, a sugar lump, a candy, a glass of fruit juice. They should then check blood sugar levels after 15 minutes and eat another snack and repeat until their blood sugar levels are within a normal range. After this, people can eat slower, release carbohydrates such as cereal, bread, rice or fruit. People will also need to seek treatment for any underlying cause. Prevention. Preventing hypoglycemia will depend on the underlying cause. Managing the underlying condition can help to avoid hypoglycemia. These are steps people can consider that may help. This include following a treatment plan. It is important to follow doctor's instructions and seek help if symptoms change. Checking blood glucose levels. People at risk should check their blood sugar levels regularly and know how to recognize the symptoms. Following alcohol guidelines. Sticking to the daily alcohol limits that a doctor recommends and avoid drinking alcohol without food. Being aware of exercise. Eating a carbohydrate-rich snack before exercising and understanding how physical activity can impact blood sugar levels. Taking care when sick. Vomiting, for example, can prevent the body from absorbing enough energy. Being prepared. Carrying a container of sugary fruit juice or a candy bar in case symptoms appear. Telling people. Those prone to low blood sugar should inform friends, colleagues and family members. Carrying medical ID. A form of ID or medical bracelet will enable healthcare providers, emergency services and others to know what to do sooner. Diet. If people have hypoglycemia or diabetes, they can discuss an eating plan with a healthcare provider. Tips may include the following. Eating snacks and small meals around every 3 hours throughout the day. Opting for a variety of foods, including protein, high-fat foods, and high-fiber foods. Limiting foods high in sugar. Hypoglycemia in children. Pediatric ketotic hypoglycemia. Some children experience pediatric ketotic hypoglycemia, a condition involving low blood sugar levels and high levels of ketones. If people do not have enough glucose to use as energy, the body begins to break down fat in the body instead. The body produces chemicals called ketones as a byproduct of breaking down fat. According to a 2019 study, pediatric ketotic hypoglycemia usually occurs due to poor intake of food, a gastrointestinal illness and vomiting, or a period of prolonged fasting. Severe metabolic and hormonal conditions may also cause pediatric ketotic hypoglycemia. Pediatric ketotic hypoglycemia may affect children from 6 months old and often resolves after the age of 6 years. Symptoms. Symptoms of hypoglycemia in infants and children may include lethargy, abnormal crying, decreased feeding, jittery, irritability, confusion, drowsiness, sweating, pallor, pounding heart. If a child shows any of the above signs or symptoms, a doctor should examine them as soon as possible.